Hey everybody, I am here with Dr. Roba at Zinnia Aesthetics and Anti-Aging Clinic. You can find them at zinniaaesthetics.com. So we're here to talk about their treatments for ED and some of the common treatments and misconceptions with that. So Dr. Roba, thanks so much for joining us today. I really appreciate it.
Thank you for having me.
Yeah, absolutely. And I wanted to start off just by asking how long you've been working in the men's health industry and specifically with ED.
I've been working in this industry since 2013.
Okay, great. And was there, anything in particular that really drew you towards that and working with those patients?
Yeah, I've always been interested in sexual health, both men and women, but more so men. And I have a practice overseas and in East Africa, and a lot of people were coming to my clinic there complaining of ED, and we're talking about guys in their 20s, 30s, 40s, something that I wasn't used to,
Sure.
a couple of decades ago. So it really sparked my interest, and I started doing some research and realized it was treatment that was needed. Unfortunately, a lot of urologists are not as interested in erectile dysfunction treatment as I think they should, and so there's a gap there, and people like me started filling it.
Mm-hmm. Yeah, absolutely. And what do you feel like it is that, a lot of men aren't willing to, talk about that and try to get treatment? It seems like it's one of those things they, just mention on their way out the door when they're seeing their primary care doctor, and it's not something they really, go out of their way to get treatment for.
Yeah, that's true, but it's culturally a very sensitive issue. It's something that is related to your identity as a man, and being unable to perform somehow. Some men think it diminishes them in some way, and so it's embarrassing to admit that you have such an issue. It's related to our masculinity, and so it is a problem. And then also society, also doctors and other healthcare professionals and society in general does not really support people that have erectile dysfunction. It's considered something that should not be talked about as much. So they suffer because the men that have ED feel inadequate, but society doesn't help them either because they're looked down upon somehow.
Mm-hmm. Yeah, definitely. It's a great point. I think that's definitely where a lot of that stigma and that embarrassment comes from, is they're just feeling like, it's an issue with them. And I don't think they understand, how many men actually suffer from that and how young that can happen.
You would be surprised, 20, 30 years ago, you're talking about EDs and men in their 60s, 70s. It's understandable. But now, the last 10 years especially, I'm seeing ED cases and men in their mid-20s, which is unheard of.
Yeah.
It is a big problem.
Mm-hmm. Yeah, absolutely. And what are some of the causes you feel like that, are starting to affect men that are that young?
That's a good question. Really, that is something that's been on my mind, especially, like I told you, in East Africa, where I used to practice, part-time. I was seeing a lot of young men who otherwise were healthy, developing ED. So the one thing that certainly is maybe not a causal, but a big reason for the rise in ED is the rise in obesity across the globe. There's a big correlation between obesity and erectile dysfunction. Not so much just gaining weight, but what obesity actually, what men with obesity develop metabolically. They're usually men develop cardiovascular issues, metabolic issues like pre-diabetes, insulin resistance, and these metabolic and cardiovascular conditions, of course, play a big role in men developing ED. But there's also something else that's going on. The diet, the traditional American diet in the US and basically the rest of the world in the developing countries, they've adopted a lot of the American style food. And they're, for the most part, very unhealthy, and that causes, buildup of plaques in the blood vessels that cause erectile dysfunction. Because, as you know, when a person comes in with ED, the first thing that a doctor thinks of is there an underlying cardiovascular disease, because it's a vascular problem, and for the most part. Now, of course, there are other reasons for ED besides that, but that's the major one. But I think the fact that younger men are developing ED makes me think also of environmental toxins that can play a big part in the this huge increase in ED cases.
Yeah, absolutely. Yeah, and I think that's a great point. And I'm sure for a lot of men, they think that there can only be one or two causes of the ED, but there's so many out there.
No, there are many different causes. Like I said, the main one is vascular. Any vascular condition, that can cause erectile dysfunction. That's the major one. But besides that, there are neurologic, psychological reasons. Certain medications cause erectile dysfunction. Trauma. So there are other things that can cause it, but the main one is vascular.
Okay. And what are the treatments that you provide there at your practice for that?
Yeah, we have a wide range of treatments. First and foremost, I think we all, since most of the cases are vascular in nature, vascular health is very important. So we believe in a holistic, comprehensive approach, which starts with lifestyle modification, and which means, proper healthy diet, exercise, helping the cardiovascular system to be as healthy as possible. Besides the diet and exercise, making sure that our patients don't smoke, don't drink alcohol in excess, or drugs for that matter, because all of these things play a part. But once we've made sure that their lifestyle modifications have been completed, then if necessary, we go to different other treatment modalities. Now, of course, one of the basic ones is vasodilators, the PDE5 inhibitors like sildenafil and tadalafil would be the go-to, but sometimes putting patients on that is not enough. The other cause reason people develop ED, which I forgot to mention, is hormonal abnormalities. Men develop, again, for whatever reason, younger men are beginning to develop low testosterone levels that directly affects their ability to have sex and to have the desire to have sex. And even in some cases, high estrogen levels in men because of the type of foods they eat, or the fact that their testosterone is being converted to estrogen, and especially in men that are obese, that can cause erectile dysfunction. So we try to, make sure that their hormone levels are within normal limits. The other thing that we have incorporated in our clinic is shockwave therapy treatment, PRP or PrEP shot. We also, in cases where we're having difficulty getting good results, we add peptides like PT-141, which is a fairly new treatment. And in some cases, we treat patients with exosomes and stem cells.
Okay, great. Yeah, and for patients that might not know how the shockwave therapy or the P-shot works, can you explain how that works to help fix the problem of ED?
Sure. So shockwave, or also called low intensity extracorporeal shockwave therapy, is a treatment modality that uses ultrasound energy that is transmitted into the penile tissue. And the basic concept behind it is when the ultrasound waves are introduced into the tissue, they cause cellular trauma. And this cellular trauma stimulates the production of angiogenetic factors like VEGF, vascular endothelial growth factor, which helps create new blood vessels to bypass the damaged blood vessels. And basically, because for a man to have an erection, blood has to flow into the penis when he's aroused. And if the main blood vessels are blocked, he can't get an erection. So by treating with shockwave and wave therapy, you can create more access by developing more small tributary blood vessels. And so that's the main way it works. There's some doctors feel that it also stimulates production of nitric oxide by the endothelial cells of the blood vessels, which helps dilate the blood vessels. And then some other doctors even think that it breaks up plaques, which I'm not so sure about. But those are some of the ways that shockwave therapy helps. Now with PRP is platelet-rich plasma. It's a regenerative medical modality in which blood is drawn from the patient, and the platelets are using a specific centrifuge made for separating the red blood cells and white blood cells from the platelets. We retrieve the platelets, concentrate them, and then re-inject into the corpus cavernosum. And the whole idea behind it is, again, the platelets release growth factors when they're in the tissue, and these growth factors, there are many of them. One of them, again, is VEGF. And so these growth factors rejuvenate, heal, and create more blood vessels. And that's how PRP works. So one works chemically, the other one works more mechanically. The PRP growth factors there are like 7 or 8 of them, and all of them are geared towards improving the muscles and the blood vessels.
Okay. Yeah, definitely makes sense. And do you usually recommend trying to do those treatments in conjunction with each other, or is it usually one or the other?
Oh, I'm a big believer in combination treatments, especially for ED, because every time you use one treatment, you end up not getting good results. So I like to approach the treatments, by combining a couple of different treatments, depending on how severe the condition is. If it's a very minor condition, we would just use the PD-5 inhibitors, but in most cases, if there's mild to moderate cases, we use a combination of, making sure their lifestyle issues are taken care of, making sure that there's no psychological issue, no issues with the kind of medications they take, if they take any that can cause erectile dysfunction. So after all that is ruled out, if their ED is mild to moderate, we suggest shockwave therapy in combination with PRP. Again, depending on how severe it is. In most cases, we like to do 12 shockwaves. The first 6 for 3 weeks, with a 3 weeks break, and then another 3 weeks. 6 treatments. And with the P-shot, the studies that have been done, double-blinded placebo-controlled studies done in Greece that showed effectiveness of PRP or the P-shot for erectile dysfunction. They did 2 P-shots, one in the beginning and then a month later. And we try in most cases to do 12 shockwave treatments with 2 P-shots. Again, if we're talking moderate. If it's mild, we combine something like Viagra or Cialis more preferentially daily, 5 milligrams, and then combine it with shockwave therapy, 6 treatments and 1 PRP. And if that doesn't help, then we do the full 12 shockwave therapies treatment with 2 PRP, and of course with maintenance down the road. Now, if all of that doesn't improves things, but not in a satisfactory way, then we consider adding PT141, which is a treatment when you combine it with PRP is very helpful. And in severe cases, we do all of the above and add shockwave therapy. For example, I had a client that came from Florida. He had total prostatectomy, radical prostatectomy. He couldn't get any erections whatsoever. And we treated him with 2 PRP, shockwave therapy, 12, and then 2 stem cells 2 months apart. And in fact, his urologist called me yesterday and said that he now can have sex with his wife for 10 to 20 minutes. And mind you, this man is in his late 70s, and he will only use Trimix, which is injectable vasodilators, if he wants to, repeat the sexual act 2 to 3 times. So that's a huge improvement. Prior, he couldn't even get an erection. So we truly believe in combination treatments.
Yeah, absolutely. And for patients that have really severe cases, is that because they haven't been able to get an erection in so long that it's more difficult at that point? Does it help to be able to, continuously use it and be able to do that and keep it going, kind of like you do with, working out, with keeping your muscles?
I'm not so sure about that. The only thing I can tell you is severe cases, I usually see them in, of course, older people with significant cardiovascular disease and or diabetes. Those are the big ones. And then, of course, somebody who's had cancer and has had radical prostatectomy, like this gentleman that I told you about. So the severity of the condition, the underlying condition that's causing the ED is really the main factor. And if you can address the underlying disease, then you can really help the patient. Now, for example, I'll give you another example, a neurogenic cause of ED. This gentleman came to my clinic. He had radiation therapy for prostate cancer He didn't do surgery, and he lost complete sensitivity. He couldn't feel anything. He could get an erection, but couldn't feel anything. And he came to me and he said, I've done my research and I've, seems like PRP and or shockwave therapy might help. And I told him, to be honest, I haven't done that many for just sensitivity, so I can't promise that it will work. But if you have no other, if you've tried everything and nothing is working, we might as well give it a try. Well, he did the treatment. We did 12 shockwaves and 2 PRPs. And about a month, 2 or 3 months later, he said he noticed a 30% improvement in sensitivity. So he said he started feeling sensitivity again. And then we rescheduled to meet in another 3 months, and he came after 3 months, and he came in kind of sad looking, and I thought, oh shoot, this thing isn't working anymore. And he looked at me and said, Doc, you've really caused me a lot of problems. And I'm like, oh my Lord, what did I do? And he said, when I first came to you, I had no sensitivity, and I had an erection, so I could last for 2-3 hours, and my wife was happy. Now my sensitivity is back to 100%, and within a couple of minutes, I ejaculated. Now my wife is pissed at me. So you caused me, So that was his complaint, and of course he was joking, but the point was that his sensitivity came back completely. And then surprisingly, 2 years later, he showed up again, but this time the cancer came back. He had radical prostatectomy, and he wanted to try stem cell treatment. So we combined PRP with stem cell. This time we didn't do shockwave therapy. We did PRP and stem cell ×2. And his urologist had told him that he may never get an erection again, but if he does get an erection, it'll probably, will take a year, 2 years before he can even think about something like that. And 3 months after I treated him, he started having erections. He went to his urologist, and his urologist said, I cannot believe I don't know what the hell you did, but whatever it is, it's very impressive. So these treatments work, but of course, you can never ever say it works for everybody. There are some people, no matter what you do, it won't work. But in a lot of cases, you can make a difference.
Yeah, absolutely. That's great to hear. And I would imagine too, with what you said about, making sure that they improve their lifestyle and making sure they make those changes too, that they can keep those benefits going on a lot longer as well.
Yes, sir. Yes, sir.
Yeah, it's good to hear. And so do you usually recommend that patients come back in and do, maintenance treatments, on a scheduled basis, or is that just as needed?
Sorry. Yes, I like, of course, because you want to do touch-up treatments when it, with P-shot, it's suggested, I'm so sorry, it's suggested you do follow up once a year. Shockwave therapy, there are different thoughts. Some say, a couple of treatments, 3 months after the last 12 session, and then another, 6 months, and then yearly after. So it depends, but there are different variations. But yes, maintenance is really important.
Okay, definitely. And do you feel like, patients should reach out and seek professional help once they start seeing any decline in their function?
Oh, absolutely. It is a must to do that. And the reason is, the longer you wait, the more severe it gets, and the more difficult it is to treat. And one of the like I said, one is because it's a taboo. Number two, because men believe that there really isn't any solution for it.
Sure.
And unfortunately, again, I'm not criticizing urologists, but I understand their focus is on treating serious urologic conditions, so that ED might not be high on their priority, and they don't have the time or energy to research about these different treatment modalities that are not to be transparent, not FDA approved at this point. And so urologists will give you a Viagra pill and that's it, and after a while the Viagra doesn't work and you kind of give up. So some of the solutions available to men may not be satisfying. The taboo is on top of that, so they don't seek help. But if they do seek help and go to the right doctor, they can get results, and their situation can improve.
Yeah, that's great to hear. And what would be the best way for patients to get in contact with you at your practice if they're local there?
Well, we're at 9872 Main Street, Fairfax, Virginia, 22031. Our phone number is 703-992-9815. Our website is www.zinnia, ZINNIA, aesthetics, AESTHETICS, one word.com.
Okay, perfect. And those are the questions that I had for you. Was there any last advice or anything you wanted to leave the patients with if they're, just struggling with the ED and not sure what to do?
Yeah, well, I would say first, look at, make sure that, your blood pressure is good, that you're eating good, healthy, balanced foods, that you're exercising, and just get checked by your primary care physician. Make sure your cholesterol isn't high, your sugar levels aren't high. Those are the major reasons in a lot of cases. And always consider, if you're on any medication, look into, and talk to your physician about if these medications can cause erectile dysfunction. You'd be surprised how many regular medications that people take cause erectile dysfunction. And once you remove or replace the medications, the erectile dysfunction goes away. And then, of course, if there are any psychological issues, dealing with the psychological issues and stress-related issues have to be addressed. And if, all of the above, you can't get any solutions for all of the things that are troubling you, then you should see a functional medicine or anti-aging medicine doctor to explore ways to treat the ED.
Yeah, absolutely. I think that's great advice. All right, great. Well, thank you so much for taking the time to talk with us today. I love the work you guys are doing there, and I really appreciate you taking the time to share the education with us. So thank you.
Thank you. Thank you so much for having me.
Yeah, of course. Have a great rest of your day. I appreciate it.
Take care. Okay, bye-bye.